And at that time, the world was truly a different place. At that moment, South Africa had not yet recorded its COVID-19 case yet. But of course, a few days later, we had our first confirmed case. And since then, we have really had our lives turned upside down by this invisible enemy. We know you have had quite a busy schedule, so we are quite honored and pleased that you followed through on your commitment that together you will meet with Sanef at least once a quarter to engage with us on some of the critical issues that are facing the country. And no doubt, this one is the biggest one yet that we have ever faced. Mr. President, as soon as the lockdown was announced, for us as journalists, work really started. Identified as essential workers, many of us started doing the hard work of making sure that we inform South Africans about what is this disease, what are the challenges, and what does the lockdown mean. But unfortunately, Mr. President, as an industry, we have also felt the impact of COVID-19. Tomorrow, as the South African National Editors Forum, we're actually launching a research that is going to give the South African public what has been details on what has been the impact of this disease. And sadly, the picture is not very pretty, it's rather quite grim. And it's that at the time when South Africans need the media the most, we are actually facing one of the biggest crises to face the industry. Many media houses, as the lockdown was announced, they saw advertising revenue all but disappear. And it has been as you know, advertising revenue is our source of survival as an industry. And since then, we have seen publications that have been around for decades, some for 100 years, having to shut down. Magazines that have been a part and parcel of us have had to shut down because of the loss of revenue. And of course, newspapers have also not been spared. As much as many...
My apologies, I have to stop you. Could we ask that you sit a little bit to your right, please, because there's an interpretation and it's going into your face. Come forward and then to your right. Perfect. Thank you so much.
Okay. Mr. President, as I was explaining, we've had so many publications having to shut down because of that loss of revenue. And also, on the other hand, we've also seen local newspapers also shutting down, many of these local publications writing in languages that are familiar for those communities. And whilst many journalists have continued to work very hard and risk everything, they've had to do that facing their own economic challenges. Many of the media houses, to stay afloat, have had to introduce salary cuts. And those salary cuts have gone as high as 40% in some of these cases. But despite all of what we are saying to the South African public tomorrow is that it's not just about the journalists losing their jobs and the media houses having to shut down, but the critical question we all need to answer is that we know that the media is the lifeblood of our democracy. And what does this shutting down of news publication mean for access to information for the public? And how do we hold those in authority accountable when when our survival is at stake? One of the great things that has happened in the past few months, Mr. President, is that we have seen an increase of audiences across all our platforms, whether it's radio, television, or online. And this is because the South African public has turned to trusted media houses so that they can make sense of this disease. And you know, in the face of fake media, many of them are looking for trusted, credible news, and they have turned to us for that information. And we have taken up that challenge, not seeing ourselves as just putting forward information, but also educating the public on how to keep safe, what is actually necessary. I think from our side, we've also welcomed some of the provinces that have come forward and have been very open in terms of providing us information, but we really still believe that there is more that government can do in giving us access to information. A lot of my colleagues have said that we would like more granular details around testing. We want the age breakdown of some of the people that are being infected or those that are dying. We would like a breakdown of comorbidities. We would also like to know how many people are in our hospitals. Some provinces have not given that information quite readily. How many people are in ICU at the current moment? What is the availability of ventilators? And we feel and believe that this information will help us in enriching the stories that we are telling to the South African public. Also, Mr. President, just to say, journalists have continued to work very hard, and unfortunately, we've lost one of our own, Lungile Tom, who died of the disease in the recent past. But also, we've also seen a number of journalists who were also infected in the line of duty. I think this speaks to the sacrifices that journalists are doing in making sure that the South African public is made aware of the disease. And lastly, Mr. President, the one incident I really would like to bring to your attention is that one of Paul Ntoba. I don't know if you are aware, but we currently have a journalist who's had to flee to Lesotho because of an incident with the police. He was out doing his work and he was confronted by police who were saying to him that he has no right to film them. And when he went to the police station to lay assault charges against those policemen, they followed him to the police station and they actually wanted to refuse him. They didn't allow him to lay charges, but wanted actually to lay charges against him. And since then, when he returned home, he started seeing the movement of police very unusual, and he was feeling quite unsafe, and he's currently in Lesotho, Mr. President. We are hoping that this matter can be brought to rest and he can be given the assurances that he can return home to South Africa and be safe and not be afraid of the very same police that are supposed to actually be protecting him. We have been interacting with IPID, but we still believe that there is more that the police can do to assure a South African citizen that he's actually safe. Mr. President, today I'm not going to say much. I'm going to leave it there because with us is a number of my colleagues who have been saying that they would like the opportunity to speak with you and engage with you, especially around the decisions that have been taken in the past few months around this disease. Thank you.
Thank you very much, Mahlatsi. Famous last words of politicians. I'm not going to speak much after having delivered a wonderfully concise opening remarks. Thank you. Without wasting any time, I would like to invite His Excellency, the President of the Republic, Mr. Cyril Ramaphosa, also to deliver his remarks, which are also going to form part of the platform of engagement. Your Excellency, Mr. President.
Well, thank you, Kusela, and let me extend my greetings to the leadership of Sanef. Mahlatsi, I greet you and indeed all your other colleagues, and want to welcome this opportunity of engaging. I had hoped that our next engagement would really be maybe a dinner setting where we are able to have dinner together and where I'm also able to ask you some questions, because I did promise that I would like to ask you some questions as well. But I guess COVID-19 has interrupted all those plans, and we will have to take a rain check and possibly do that at another stage. I'd like to confirm that I remain open to engaging with the media on a regular basis, and this is one of those occasions which I really welcome. And our engagement now is taking place on the eve of a new phase in our national response to the pandemic. And the move to level 3, which starts on Monday the 1st, in many ways marks a significant shift in our approach to the disease. Having moved from a lockdown to intensive public health management is quite a shift. This is a useful opportunity to reflect on the progress that we have made since we started dealing with this pandemic, and also to look at the current state of the pandemic, and also have an opportunity together to look at the road ahead. This is also a chance to applaud and thank the media in South Africa for its indispensable contribution to the national effort to deal with the virus. And I must say that right at the beginning, when we made the lockdown provisions or announcement, the media for a while had not been identified as essential, and you immediately raised the issue, and it was an oversight on our part, which was quickly corrected because of your own interventions, which we thank you for, because the continued interventions between the media and government is quite helpful. Now, through the media's reporting on the disease, you have really helped to inform and to empower the people of our country, but you've also stimulated public debate. But much more importantly, you've also helped to promote accountability and to hold those of us who are in positions of authority and leadership to account for what we do, for the decisions we take, or decisions that we don't take. So we welcome this. However critical it might be of us, we welcome it because we have a constitution that promotes media freedom, and the media plays a very important and critical role in the political architecture of our country. And we want you to continue fulfilling this role. And this time round, you've been fulfilling it under very difficult conditions. And it has also required new ways of working, of reaching readers, listeners, and viewers. And I'm delighted to hear you say that the public of our country has been turning more and more to the various mediums that you have to communicate, and the trust is being regenerated, and we are very delighted with this. This is a time when most media organizations, as you correctly say, are facing real difficult financial challenges. Now, I'm glad to hear that you're having your Sanef forum tomorrow, and we would like you to engage with government on some of these challenges in a, if you like, a particularized way, so that we are fully aware of some of these challenges and see the extent to which, without interfering with the independence of the media, where government can be able to reflect, to suggest, or to even assist. So, Mahlasi, I would welcome an opportunity that you should interact with us, and rather than stay out there and see media houses collapsing, let's have a discussion and see what it is that can be done. Now, like so many others in society, journalists have certainly played their own part in this momentous struggle of overcoming the virus, and continue to do so. Now, of course, we have to pay our condolences to one of your colleagues who passed away. I was very saddened when I heard that your colleague Lungile Tom had passed away. It was a sad moment, but I'm also quite unhappy to hear that there is another journalist who has had to flee the country and go into Lesotho for fear of either being arrested or fear of being dealt with. Now, I'm going to direct the Minister of Police to make sure that he has safe passage back into South Africa, and he should not be molested in any way. And Colin Toba, as you said, I'm going to get the Minister of Police to make sure that he does come back and he's not subjected to any threats, any form of harassment, because as you correctly say, he was doing his work. And police have no business in interfering with the media when the media is doing, or journalists are doing their work. And as you would be aware, our approach to this pandemic has been informed by the view from the scientific community that most South Africans are likely to be infected by the virus at some point. And you, as the media, have been communicating this very, very strongly and very effectively. And we're particularly pleased about that, because you've helped to spread the message and also make so many of our people aware of the dangers that we face. And let me immediately say that wherever I go, whether I'm walking in the street, on a morning walk, I find that people are either wearing masks and safe distancing. And this has largely been the messages that you have been spreading as the media, and we'd like to thank you for that. While the overwhelming majority of South Africans will be affected by this virus, in the end, many of them will not have symptoms, or some of them will only have mild symptoms. And a small proportion of people infected will develop severe symptoms and will need to be hospitalized. And for a proportion of these people, the virus could also be fatal. And that is the sad part about this pandemic. And as we've seen in many other countries, a small proportion of a very large infected population can quite easily overwhelm the best equipped health systems. And some of the countries, particularly in the Northern Hemisphere, have really advanced health systems, and we've seen how some of those have been overwhelmed. Our strategy has therefore been to prevent a massive spike in infections by delaying the rate of infections, and to simultaneously prepare our health system for what I would call the anticipated surge in cases, and put in place broader public health interventions. Now, we've been through 65 days of the lockdown, and we can reflect on how effective this period of our strategy has been. And we need to ask ourselves whether we have achieved what we set out to achieve. We have started, in our view, to flatten the curve, which was the strategic objective that we had in mind, to flatten it and to slow down the rate of the infections. Now, the latest report, and we all get the same reports on an ongoing basis, has confirmed that we have 30,967 confirmed cases in our country. And of these, around 52% of those people have recovered. The lockdown significantly reduced the rate of infection. And before the lockdown, there was a doubling of coronaviruses every 2 days. During the lockdown, it reduced to 15 days. During the easing of the lockdown, with the implementation of level 4, we've found that the doubling of the infection is now reduced to 12 days. Now, of course, the Western Cape has been the hardest hit by this disease. It currently accounts for 65% of all confirmed cases, and the doubling time of the cases is 9 days, as opposed to 12 days nationally. It is therefore of utmost importance that we reduce the rate of the spread in the Western Cape, and that we should do everything possible to prevent other parts of the country from following a similar trajectory as the Western Cape. So far, we've recorded 643 deaths. This is a case fatality rate of 2.1%, which is far lower than what you would call the global average of 6.4% and the European average of 8.5%. So in this regard, we are doing far better than many other locales in the world. Our priority now must be to ensure that we have sufficient health system capacity to provide lifelong, life-saving care to all those who may need it. In the coming weeks, we should expect an exponential rise in cases, and we need to deploy all the means at our disposal to continue to flatten the curve. Now, we have strengthened our public health interventions. Since we began our community screening, we have over 13 million individuals in our country who have been screened. And of all those, 188,000 have been referred to testing. Now, all in all, when it comes to testing, so far we've tested 710,000 South Africans. Now, these were referred to through the community screening process that we said we would embark upon. This is a phenomenal achievement looked against what is happening in other countries, but more particularly also on our own continent. We are testing much more than others, but we will not stand on rooftops and boast about this like others do. Now, as people return to work, school as well, and studying, we will be significantly expanding the screening effort to all places where people congregate. However, with such a high proportion of asymptomatic cases, we need to complement screening with a range of other preventative measures. We also need to be more targeted in our testing due to the severe global shortage of test kits and supplies. Now, another important element of our public health response is contact tracing. Nationally, around 96% of identified contacts are being traced. Although this number is significantly lower in the Western Cape and in the Eastern Cape, still this remains an area of weakness in our interventions. We're currently identifying an average of 2 contacts for each confirmed case, whereas other countries like South Korea have been identifying around 20 contacts per case, which is quite phenomenal, and that is where we want to get to. We have improved the capacity of our health system, and we're keeping improving it. And we're guided by the modeling that has been done on the trajectory of the disease. We have been working hard to expand the capacity of our health facilities. To date, over 27,000 beds in the public sector have been allocated to COVID-19 patients. And I'm acutely aware, Mahlatsi, that you would like to know much more information about what is happening with people who are admitted, how many are in ICU, and all that. And I agree that that information should be made available, and we should be able to create a platform where that type of information can be easily available. I don't see any reason why that type of information should not be available, including the age profile of those who are infected, the regional profile and the district profile, and much more, even a ward profile should be built, and we should be able to have access to it. Now, the field hospitals that are currently being built will have around 13,000 beds. And I've said, in fact, that number would be a lot higher because Gauteng alone would have about 10,000, and KZN is already ramping up. And indeed, the Western Cape. So field hospitals across the country are ramping up, and they are going to have many more beds that will be made available. Now, with the assistance of various governments and companies, as well as foundations, we have been able to mobilize significant quantities of personal protective equipment and other medical supplies, both diagnostic and in some cases therapeutic, as well as ventilators. Our attention has not been limited only to our country, but we've been working with other leaders on the continent and globally to ensure that Africa has the resources that it needs. Now, a few days ago, I was in discussion with President Xi Jinping of China to secure diagnostic supplies that we need, because as you will have heard, we are running short of test kits. But that is not only us in South Africa, the entire continent. So what we did was I appointed an envoy in addition to the other envoys who are looking at the financing aspect as well as the debt aspect. I appointed Mr. Strive Masiyiwa, who is a business leader, has businesses both here in South Africa and in Zimbabwe and other places on the continent, to be our envoy of the continent to scour the world and find these diagnostic as well as therapeutic medical supplies. And we've been able to have a great success just in the past few days of getting the suppliers in China, with the intervention of President Xi Jinping, to agree that they will make available up to 30 million test kits for us on the African continent. And they will make these available, almost 30 million per month, as well as 10,000 ventilators per month and 80 million masks per month for our continent. And what we are now doing is to set up a procurement platform, which we are going to launch next week, which will allow every country on the continent to be able to procure from a central place and benefit from the scale through which we will be buying from the various suppliers in China. And we want to be able to bring in other countries as well that can build these. But we are also adding our own suppliers onto that platform. South African suppliers who are making our masks, South African suppliers who are making ventilators are also going to be flighted on this platform. Also, a number of other suppliers and manufacturers on our continent. So we're building a huge platform that is going to be able to enable countries on our continent to acquire these diagnostic as well as therapeutic medical supplies with greater ease. And as we launch it, we will also explain how the procurement process will work, the financing that we are mobilizing, that countries that may not have the necessary finance should be able to obtain finance. But the pleasing part as well is that because we are procuring so many supplies, we are going to be able to have to transport these. And we've said we will fetch those supplies so that we are able to have line of sight of how these will be transported and delivered. And these will then be also transported through South African Airways, Ethiopian Airways, and Kenyan Airways. So Johannesburg will become the hub, and Addis Ababa will become another hub where all these supplies will be sent, and then your more regional airlines will then be able to deliver them all around. So this is going to give a great boost to South African Airways, because this process will be going on for many months to come. And this week alone, we will be receiving a supply of 1 million masks from one of the telco companies, Huawei, who have donated. We are working to also grow local production through our work with different industries in our country, and through the support we are providing through the IDC, the National Empowerment Fund, and others. Companies across the country have repurposed some of the production capacity to supply the country with alcohol for hand sanitizers, face shields, as well as masks, ventilators, and other essential medical supplies. Now, the other day I was walking during my morning walks, and I came across a gentleman who just greeted me in the road, and he said, "Mr. President, I'd like to thank you because I'm one of those early recipients of the assistance that government has made available to us as business people. Got my assistance in April. I've now imported a machine that is going to make masks. I used to import masks, and I've given heed to the call by government that we should localize and make masks here." And he said, "You'll be pleased to know and to hear that we're starting our production in 2 weeks, in June. We're going to start producing masks, and we are going to employ 75 people from our newly constructed manufacturing facility." So that for me was very pleasing, and it gave credence to this idea that we've been articulating, that localization has to be one of the spin-offs that we get from COVID-19, because this is the time when South African companies can, live up to the challenge of producing all these diagnostic as well as therapeutic medical supplies that we need. Now, the coronavirus itself has not only presented us with enormous challenges, it has also created a number of opportunities that we must capitalize on, and we must see a silver lining below this very dangerous cloud that hangs over our country. It has shown that the state, which has always displayed signs of incapacity, as I've stated before, but when it is called upon to do so, it does have the capacity to implement programs that improve the lives of our people, from food distribution to the provision of water, from wage support to millions of workers, and to assistance to small businesses, but also to assist those millions of South Africans who are unemployed, and to create a platform and a facility and a channel through which we can do that. We've also, during this period, been able to process the data of 6 million South Africans who have come forward to receive the special relief grant, and we will be able to distribute that grant in quite an effective way as we move forward. Now, because of COVID-19, we have had to quickly improve also our health system to be ready to serve everyone, regardless of their ability to pay, which is a fundamental principle of the NHI. And I would like, all of us to see that this could well also be seen as the genesis of an NHI, because no one who is infected by COVID has been turned away. They've actually been accepted and admitted in our health facilities. And this is precisely what the NHI is aimed at doing, that without regard to your status in life, how much you earn, and where you live, people have been admitted to our health facilities and given the treatment. And the fact that 52% of people who have recovered have gone through our health system is a good proof of the ability of our health system to also live up to this challenge and even greater challenges post-COVID-19. So we are going now through the process of putting in place the pillars for NHI, and would want to see COVID-19 leaving a legacy of an NHI that we can be proud of into the future. We have made massive investments in health infrastructure, improving the quality of existing buildings and movable assets. And earlier I said, rather than just put up these filled hospitals, let us see whether we can append some of these additional facilities we are building to existing hospital facilities. And I'm pleased that many of our provinces have heeded that call, because whilst they're putting up filled hospitals in stadiums and warehouses and storerooms, storage places, they are also looking out for expanding the facilities in our existing hospitals and other health facilities so that we can benefit from this post-COVID-19. And we've also invested in information technology to collect and manage data. For example, in 2 months, we've built cell phone technology for household screening and to assist patients to visit health facilities or collect medicines. We've ramped up our capacity to monitor the performance of the health system in real time, and we are building this up as we move on, and as it were, building a plane while it's flying. And this is what COVID-19 has given us the challenge to do. And in many cases, we're living up to it, and in others, yes, there are weaknesses. We have quickly adapted to holding remote meetings, training courses, and even parliamentary committee meetings. And the way we are meeting now was unheard of. We never even knew that we could be as efficient as we are. And in government circles, we've also reduced the time and cost of travel because we're able to meet as we are doing now. The allocation of temporary spectrum during this period has been another phenomenal achievement, because it demonstrated that we can actually release spectrum that can enhance our ability to function, and it has eased many constraints. And we are using this pandemic to fast track also the implementation of the district development model, which we launched last year, and ensuring that the different spheres and departments of government work more effectively and depart from the silo manner in which we've been working to fulfill a common mandate where every department and every sphere of government is able to communicate on what needs to be done. Now, the Minister of Health has said that the best way of tracking the pandemic and ensuring that our preventative health measures work is to implement all these interventions at the district level. And to this end, we will be deploying our ministers and deputy ministers, including some directors general, to all the districts in our country, as well as the metros, and depicting them as district champions. They will enable us to have a better and a much greater focus on all the districts and metros. This will put our health interventions in a much stronger position, particularly in the hotspot areas that we've delineated. We have extended the special COVID-19 employment benefit to unregistered domestic workers. This highlights the need to register all employees in private households. And because we have found that many, even the employees in the various households, are not registered. And we are now calling on all South Africans, register the people who work in whatever facility, business, or even household, because it is important for us to have this national data system. When we declared the nationwide lockdown, we knew that it would need to be limited in duration. Our economy would need to restart, and people and companies would need to start earning an income again. We also knew that the lockdown would only delay, but could not stop, as I've often said, the spread of the virus, and that we would need to brace ourselves for a significant increase in infections after the lockdown. Now, this was initially expressed to me by Minister Mkhize right at the beginning when he said, "Mr. President, many South Africans are going to be affected and infected by this virus." And I immediately just wanted to walk away from him because he was, to me, saying something that I did not want to hear. But as it has turned out, that is the reality that we face. So we've got to live with the virus, and the implementation of Alert Level 3 marks the start of the next phase of our strategy. It involves a shift from the extreme social distancing, which took the form of the lockdown, to a broader range of public health interventions. This is what we have called our coronavirus toolbox, and I've spoken a lot about this in terms of what it will entail for our people to change behavior and to observe the basic hygienic practices we are now all familiar with in regard to wearing masks and washing hands and cough etiquette and so forth. In the second instance, it relies on social distancing measures, sanitation, and strict hygienic practices in all places where people congregate, including workplaces, shops and malls, public transport, schools, universities, and places of worship. In the third instance, this phase focuses on public health interventions that are going to be much more rigorous, including widespread symptom screening at places of work, schools, and other institutions. It will also have to include focused testing and contact tracing, where we've been rather weak and where we need to upgrade our effectiveness. We have introduced a differentiated approach, as we've all had, between areas of high infection, known as hotspots, and areas of low infection, which require ongoing vigilance and surveillance. Now, special interventions will, as we have said, be made in hotspots, and that is going to revolve around a multidisciplinary team effort, which will need to be deployed to contain the outbreak. And as Minister of Health has told us before, that they have identified areas where these outbreaks have really been going up. And they will include all the health specialists, doctors and nurses and community health workers. Now, each hotspot will be linked to testing and quarantine facilities and additional hospital beds. There will be a close focus on tracing contacts and isolating. And I've said that we need to focus on this contact tracing thing or process. Originally, the intention was to place hotspots areas at a higher level than other areas, but it became evident that this was going to prove impractical and would undermine our efforts to reopen the economy. For instance, having identified Ekurhuleni as a hotspot in Gauteng, if we had left Ekurhuleni alone in level 4, it would have been very difficult to cut out Ekurhuleni when people who would be in level 3 in the rest of the province, in Johannesburg and other areas, have to travel to work in Ekurhuleni. So we relied then on differentiating that area by having a much more focused effort. Having different areas at different alert levels would simply disrupt supply chains, create a multiplicity of regulations to enforce and even increase the movement of people between hotspots and other areas, as I've said. If it becomes necessary, and touch wood, we hope it will not be, and all other hotspot interventions do not work in containing the spread of the virus, then some hotspot areas may have to be placed at a higher alert level. but I'm hoping that our interventions will prove much more effective. The new phase of the strategy is in line with the approach that we outlined from the start. Now, the first stage was preparation, even before we recorded the first case in the country, then primary prevention, then the lockdown and the surveillance and active case finding, and now hotspot intervention. This is not a case of government stepping back from the crisis, but of government working with all social partners to intensify our efforts across a broad front of interventions. We are reopening most areas of the economy so that people can go back to earning a living, so that this immediate health crisis does not result in a permanent economic crisis. At the same time, we are retaining many restrictions on personal movement and gatherings to limit transmission. Now, social and economic interventions were largely made up of 5 components that we embarked on to support households and communities, protect workers, sustain businesses, strengthen public health interventions, and strengthen the economy. Now, our initial interventions that had economic assistance measures came up to 1.7 billion, as we might recall. It clearly was not sufficient, as it amounted to only to about 0.01% of our GDP. As the scale of social and economic hardship became apparent, the response had to be scaled up. And that is what led to the 500 billion assistance measures that amounted to 11% of our GDP. This was in line with a number of what developed economies have been doing, and also medium income countries have also done to shore up their own economies. Now, the return of economic activity will take place alongside the implementation of this social and economic relief package that we announced. Now, that is ongoing as everything unfolds. The central part, of course, as we know, of the package is to support poor households, informal workers, whose incomes have been severely negatively affected, through the top-up of social grant payments and the special COVID-19 distress grant. An additional amount of around 50 billion will be transferred to poor households over the next 6 months. Now, establishing this special grant, which is targeted at the unemployed who do not receive any form of state support, has been particularly challenging. Now, the application and the screening and approval and payment mechanisms had to be set up within a matter of weeks. And what is pleasing is that capacity was established within government institutions to put this in place. And as I said, 6.5 million applications have been received. Now, up to now, which is now going to ramp up, 117,000 grants have now been paid and processed, because it took quite a while to process. And of these, 1.6 million have so far been rejected because the applicants did not meet the eligibility criteria, in that some of them are recipients of one grant or another. The measures we have put in place to help companies in distress, to mitigate the effect of lockdown, have actually been of great help to many of those companies during this very difficult period. Since it was established, the relief scheme of the UIF has now paid out over 15.8 billion rand to 3 million employees from 200,000 companies, which is quite phenomenal, because the UIF has never really been stretched to this level itself in terms of having to pay out any benefits. So this is a first for them and a first for our country as well. Now, the various funds that we established to provide support for small businesses, including the initiatives of the Department of Small Business, the Department of Tourism, and the IDC, and the South Africa Future Trust, have provided direct assistance to over thousands of enterprises. And this has helped to ameliorate the difficulties that many of these enterprises have been going through. Now, a significant development has been the 200 billion loan guarantee scheme, which is guaranteed by government, which has begun processing applications from small and medium-sized businesses. Now, I have said to colleagues who've been working on this that it will be good if this is increased, because the need is going to be much more than 200 billion. It is possibly going to run to 300 billion. We need to show up those employment centers, companies, small businesses, and medium businesses, so that they are able to protect the jobs of people who work for them. So I think we're going to need a much bigger fund. But that obviously we will need to look at as our phases of economic recovery go on. Now, several commercial banks and insurance companies have also assisted the economic relief effort by, among other things, delaying or reducing installment payments, providing debt relief, and waiving bank fees for grant beneficiaries. And in some cases, this may not have happened as people would have thought it would happen. And I would encourage everyone who runs a business and so forth, if you're not in receipt of any measure that can assist, you should approach those institutions, because this is a time of solidarity. This is a time of assistance that needs to be given to both individuals as well as to companies. So all we need to do, all of us, is to go and make the approach, because the assistance measures have been put in place. These measures have been supported by quite a lot of money that has been set aside, 70 billion in tax relief, and a substantial monetary stimulus that our central bank has also come up with. Now, as the economy returns to operation, many of these measures will need to be sustained, as a lot of companies will continue to face difficulties. It is our intention to assist as many as possible to get back on their feet as quickly as possible. While we are firmly focused on the task of fighting the pandemic and saving lives, we are also turning our attention towards a sustainable economic recovery. Now, as I've said before, we are resolved not merely to return our economy to where it was before the virus, but to forge a new economy in a global reality, rather. What this calls for is that we need to reset our economy, and we need to focus on how best our economy can be transformed. In my view, COVID-19 changes everything. It is going to change many things, and it also will change the way our economy functions and the way we also interface with our economy. Now, our economic strategy going forward will require a new social compact amongst all role players, business, labor, community, and government, to structure the economy and to achieve inclusive growth. Among other things, we will need to accelerate structural reforms that we've been talking about for so long, some of which are now unfolding and being put into practice. We will also need to focus, as I've said earlier, on promoting localization. And this is, in my view, a mindset change. And in a way, it is also economic patriotism. We'd like to see all of us as South Africans becoming more patriotic, even when it comes to our economy, and localize as much as possible. Many countries that have gone up the ladder of economic growth have been able to produce their own food, they've been able to produce their own healthcare supplies, and we can do as much as many other countries have done. And this is the time to also industrialize and to be serious about industrializing and to beneficiate as well, and to repurpose our state-owned enterprises and strengthen the informal sector. Now, a key driver of this recovery will be a massive infrastructure build, as well as a very focused maintenance program that needs to mobilize public and private resources on a significant scale. Another focus will be a massive employment drive that will involve resetting our public employment initiatives. And we will need to look at the public employment initiatives that we've had and see how best they are repositioned, recrafted to accommodate the many millions of South Africans who are now going to be jobless. And this we now need to do with a greater urgency as we move forward, and focus particularly on women empowerment, youth employment, and also ensure that the various programs that we've got in place do actually work and they succeed. Now, starting with the recruitment in this stage of COVID-19, there are quite a number of interventions that we now need to embark upon. We still need to do a lot of screening, and therefore we need a number of community workers who will be brought into the field to go and do screening. We're working on plans to create employment opportunities also for our social workers. This is a time when our social workers need to be binding the wounds of our nation. Many people have been negatively affected by COVID-19. We need to deploy professionals and people who have been unemployed for quite a while. And COVID-19 then gives us the platform and the opportunity to be able to do that. We need to look after community infrastructure. Our schools need to be looked after. And we need to invest in the environment. And we also need to focus on early childhood development as we go forward. And we therefore need to start creating new sectors of the economy. New sectors, the K economy is one of those, the green economy is one of those, and a number of other subsectors of our economy can be created. And so therefore, COVID-19, as we move forward, from a strategy point of view, we can craft quite a number of possibilities that can ensure that our recovery out of COVID-19 is a lot better. This will take place alongside the work that needs to be done to unlock employment in the wider economy, no doubt. It is nearly 3 months since South Africa recorded its first COVID-19 case. The measures we've taken since then have managed to significantly reduce the rate of infection within the population. At the same time, these measures have resulted in massive disruption in people's lives and have placed livelihoods at risk. And some of the regulations that we've put in place have not made everyone in our country happy. And people have sought to find out why were certain regulations put in place. And people are correct to ask that. And obviously, over the next coming while, we will need to explain and to put in place the rationale why certain decisions were taken. As we steadily open up the economy and enable people to return to work, we're now entering the most challenging phase of our response to the pandemic, which carries the greatest risk possibly for massive and uncontrollable rise in infections. The weeks ahead will be crucial and will require great vigilance, caution, as well as effort from all South Africans. Now, from the experience of the last 3 months, from everything that we've gone through, everything that we've achieved, and all the hard lessons that we've learned, I'm convinced that we will succeed in overcoming the pandemic, particularly because we've got the tools. We've been given the toolbox, and through these tools, we should be able to flatten the rate of infections. Having used possibly the big bazooka and maybe the nuclear weapon, which is the lockdown, the hard lockdown, as we ease, we now need to use the other tools. And the other tools have been well articulated to our people. And I can say that it is pleasing to see that South Africans are heeding the call not to shake hands. I have not met a single South African in the past 65 days who shakes hands, almost three months who's now shaking hands. People no longer shake hands. People no longer hug willy-nilly. People now wear masks. Wherever I go, whether I walk in the street and I go to some public place, people are wearing their masks. And the social distancing is beginning to grow on us. Many of us are beginning to demonstrate that social distancing. And I believe that if we use all those tools, we will be able to navigate our way in the next 2 years as we live with this virus, possibly 18 months or 2 years, because that is now what we have in place. Of course, as we intensify screening and testing, and to finally flatten the rate of infections. Colleagues, I'd like to thank you and welcome this opportunity of being in conversation with you all. Thank you very much.
Thank you very much, Your Excellency, Mr. President. I wonder what would happen if I said that brings this broadcast to an end.
They're waiting.
All right. I already have 2 hands up. I think we'd agreed that we would take 3 hands in the first round. Maybe let me request that we keep them quite short. Maybe we take 5 just to give the president some breathing time, and then we'll come back in the next round. Please use the thingamabob, the raise hand function. First question is going to come from Clement Manyatela. He'll be followed by Sbungwala, then Kanita Hunter, Adrian Basson, and Valdemar Pelser will be the last one in this round. If we could take them in that order, please. Clement, you are first.
All right, Mr. President, thank you so much for engaging with us. I've got 2 quick questions. The first one is around the communication by your administration. There are some ministers and some South Africans that have raised concerns around the tone of some of the ministers when they speak to us as the nation around the lockdown regulations. Some regulations, it appears, are made up as the ministers go. You know, things like if you are found with smoking, you may be asked, where did you buy this? Can you produce a slip to prove that you have purchased this and where you purchased it from? So how concerned are you about that communication, the tone, and the fact that there is just some discrepancy in terms of the regulations that the ministers are putting forward? And how do you plan on strengthening communication to avoid confusion? My second question is on the lifting on the ban on the sale of cigarettes. I want to ask, Mr. President, who advised government initially when you announced that the ban on the sale of cigarette would be lifted? Did you consult with the health experts? I'm asking this because when that decision was reversed, we were told that it was reversed because the experts have advised that the sale of cigarettes must continue to be banned. So who actually advised initially? Where did you get the advice on the lifting of the ban on the sale of cigarettes? Thank you very much.
Thank you, Clement. Smooth.
Thank you, Kusela. Mr. President, from the beginning, you have told us, and the ministers have also told us, that government's decisions around the response to COVID-19 are informed by science. And tomorrow, Mr. President, we have the majority of the workforce, about 8 million people, who will be returning to work. And we've also heard at the same time, I think it was the health minister saying that the WHO had advised South Africa to stay on lockdown level 4 because we're still going to see a spike in infections. The question here, Mr. President, is based on that, is it actually, would it be correct to say that some of the decisions that are taken are now not solely based on science, but rather the socio-economic factors in the country takes precedence? And if not, Mr. President, maybe you can explain then what was the science in deciding, for instance, to allow churches to operate and not restaurants to allow for sit-downs. And secondly, Mr. President, we truly appreciate this opportunity, and I think it actually comes at a time when South Africans and ourselves as the media have been actually hoping for more visibility, where you'd be able to address us as a nation, but also to take questions. Would this then mean, Mr. President, that now we'll be seeing more of you, and that perhaps in the future you will consider, after you address the nation, that you would take some questions from journalists? Thank you.
Thank you, Smooth. Kanita.
Thank you very much. Mr. President, there seems to be a disconnect between some of the announcements that you make and the implementation thereof by the executive. I know you speak about the capability of the state and how it's been improving, but there seems to not be any consequence management in terms of departments or ministers unable to follow through on the announcements that you make, whether it's the 350 Rand grant, whether it's now the crisis with the schools. Do you have any measures in place to deal with this, to say I've announced A, B, and C, and how well is this being executed? And then can we see some transparency in ministers being held accountable for not following through on the announcements that you make, Mr. President? And secondly, in terms of the economy, what does SOEs look like to you in a post-COVID world? And what does a future SAA also look like after this? Thank you very much.
Thank you. Colleagues, I'd like to perhaps give an opportunity to the President to respond. I was thinking I'd have 3 questions, but I have 6. So let's give the President to respond. Adrian, you'll come in the next round.
Thank you, Kusela. Clement, let me start with you.
Sorry.
On the issue that you raise on communication, that there seems to be sometimes discrepancy between what is set out in the regulations and what is finally also implemented. And you give a very sort of graphic example on, for instance, cigarettes, and you say, there's a ban on cigarettes, and then the police will follow a person up to a point where they say, where did you buy, where is the slip, and all that. And I would say that on the communication side, we have spoken about this very recently, and I have been saying to the ministers that let us make sure that our communication is clear, direct, and that we should not be seen to be contradicting some of the things that we say on an ongoing basis, or misinterpreting also some of our own regulations. And we need to tighten up the communication. I think what you can admit is that there has been transparency in communication from government, and government has been communicating on a regular basis. And yes, there will have been occasions, and there are occasions where the communication might have slipped, and might not have been spot on. That we will concede to. And also, the very graphic example that you gave, Clement, is over-enthusiasm. Over-enthusiasm. When we imposed the lockdown, we said, and I said this specifically when I addressed the police and the soldiers, that we should not be going out there amongst our people as though we are confronting an enemy. We are not enforcing something that is enforced during a wartime, where there are bombs, blasting all over. It is a process of encouraging our people to act in a way that is going to save lives. That I communicated very clearly. And of course, because we are dealing with so many people, so many officials right across the country, there would have been, and there are, those whose enthusiasm actually goes ahead of them. And what we do need to do, and even at my level, is to continue reinforcing this message right across the board, including amongst my own colleagues. So that is a point well taken. The issue of the cigarettes, what advice did we rely on when we initially said the cigarettes could be sold? Of course, we rely on a variety of advices. And we also we take time to discuss those. Of course, there are quite a number of doctors and professionals who advise us about the dangers of cigarettes, of smoking rather. And at the same time, in the National Coronavirus Command Council, when we discussed it, we looked at the point at which we could actually ease the restriction on cigarettes. And when the initial decision was taken, we obviously had also gleaned on the advice that was there from the medical field. But at the same time, we felt that because people do smoke in our country, there needs to come a time when the restriction will be lowered. And when I did announce that we were lifting the ban on cigarettes, and later changed it, the change came about as a result of a flurry of concerns and objections that were raised by a number of South Africans in their thousands. We then had to go back to the drawing board and then finally announce a change. And now, obviously, people have taken issue with the way the announcement was made. It was made by Minister Dlamini Zuma. And what we should have done is, the president having announced it, the president should have been the one to announce it again and give reasons why this was being changed. Now, that was not done. That was not done, and we will concede that as well. It should have been done, because then it created a very unpleasant type of situation where people started saying that the minister was undermining the course of the other regulations that were being announced. And let me say that, yes, we continue to follow scientific advice. Sbu wants to know how we are now able to allow up to 8 million people to go back to work. And he says, is it correct that some of those decisions that are being taken because we are under pressure from a number of interest groups? Let me say that the scientists are the ones who continue to lead our effort in all this. What they have advised us is that we needed to impose a lockdown, which we did. And they said it would help to flatten to flatten the curve of the infections. And with that, we will then have sufficient time to prepare ourselves, to prepare our healthcare system, to prepare our tools to be able to deal with the spike that is going to follow. But they also said, once we had gone through level 5 and level 4, they said the lockdown has served its purpose. In fact, what they were even advising, SBU, was that you could quite easily go to level 1 because the lockdown has now become a blunt instrument. You've served the purpose. You now need to rely on other tools. Now, they have scientifically crafted all those tools that we now need to rely on. And that is the advice that we are heeding. But we also had advice from the World Health Organization. The World Health Organization was saying, we advise that countries should ease lockdowns gradually and slowly, and do so as the infection rate goes down. Now, armed with both advices from the two centers, the National Coronavirus Council and the Cabinet decided that we are going to take a midpoint and do it gradually. Rather than rush quickly to level 1, as advised through, yes, the scientists, we said, let us rather go to level 3 and gradually move on to level 2. This will also help to give us time to get even more ready throughout the country, as we are doing now. There are quite a number of areas in our country where we still need to button down our state of readiness. We still need to have more health workers to be brought on board to go and do the screening throughout the country. We still need to set up testing. And as you have heard, our testing capacity is still not at the level where we want it because we've been running short of tests instruments. We're hoping that as we get them now with a new offer, we will be able to ramp up our tests. So those are all the instruments that are informed by science. And so science has been very much at the center of all this. And it is what has now informed us to say, yes, as we now move down to level 3, it is time to open up the economy because we cannot keep the economy shut forever and in a day. We do need to open it up. People do need to go back to work. But even as the companies do open, we want to ensure that our tools are put in place. Every measure or intervention that needs to happen should be in place so that we are able to keep the curve going down. So when it comes to the churches, we were approached by the churches, and they approached us long ago. And let me say, when we initially did the lockdown, there were a number of churches that felt that no, they didn't really submit themselves to a lockdown. Through consultation, we were then able to get all the churches to agree to a lockdown. And of course, it needed to be enforced by the state. And let me say, we are very, very pleased that the churches, by and large, and in fact, all of them, complied with the lockdown provisions, from small churches to the large churches, realizing the dangers that people would be open to. And as we've now moved to level 3, the church leaders and in all formations of faith-based organizations came to us and said, we would now like to allow worshiping to happen, and we've got the protocols in place. For instance, the South African Council of Churches came with a well-documented protocol guideline and said, this is what we would do. We would not allow this and that and that, and there would be restricted numbers of people, and people would not be willy-nilly allowed to come in, and so forth. And it was at their instance, and also observing the fact that, yes, we are now moving to level 3, where we are, for instance, going to now be getting people to go to work. People are going to go to work, and they are going to be working side by side. And in the mines, in our factories, and we're also going to be saying our grade 7 and grade 12 children can go to school. And they are to be learning side by side, separated by a meter and a half, with all the masks and the hand cleaning and all that. And we said that if it is self-controlled, as we expected it to be, and as it was articulated to us would be, was something that could be allowed. And it was that informed that. But more importantly, the churches themselves have been saying, we are not ready. We will not be ready as of the 1st of June to comply with all these provisions. And in fact, some of them are saying to us, we will only be ready in August. We will only be ready in September. And we've said, we welcome that. We've also welcomed those who have said, because we are not ready at all, we are not going to open. So our approach has been based on consultation. It's been based on discussions with the religious organizations themselves. And I believe that it will be well managed. And I'm rather pleased that they also see the time frame of being able to do this is going to be elongated. It is going to be later in August. And at the same time, we are having discussions as we've been approached by the tourism sector with restaurateurs as well as hoteliers about their own situation. And we are having discussions on those. And what I can assure all of us is that we are very serious about taking due care about the safety of South Africans. And where we see that the spate of infections could start rising, as we have seen in shopping centers in the Western Cape, as we have seen in a number of areas in shoppings in the Western Cape, we are going to immediately make interventions to stem that and to stop that, because our approaches really have to be based on saving lives as well as preserving livelihoods, and that is what has been driving us. And it's not been based on being put under pressure by certain interests. It has been science-based as well. Now, you ask whether I will be able to take questions going forward. Yes, the answer is yes, we will be able to take questions, and I'm happy to do so, as obviously we do nationwide wide addresses. We will do that, and then on a following session, we will be able to take questions because those are structured in a particular way. Juanita wants to know about the disconnect and the implementation of decisions that we take. Is there any consequent management? And her issue is decisions are taken and announced, and then there is no implementation. Now, as I've said repeatedly, one of the challenges that we've been facing, which I have identified over and over, is the capacity of the state. The state that, if you like, I inherited has been a weakened state in a number of ways. And much of what we've been trying to do is to show up the strength of this state. The district development model is one pillar around which we want to strengthen the state and destroy the silo mentality of doing things in government, where one department does not know what the other department is doing, and where we can enhance implementation of decisions that are taken. Now, as we enhance this capacity of the state, of course, there will be a number of instances where there are weaknesses and where, for instance, there is no proper follow-through. I mean, you give a very good example, about the implementation of the payment of the 350 Rand to the unemployed people in our country. We took the decision, and having taken the decision, and in a way, this decision was like unexpected, to those who would implement it, because they had to craft a new way of paying an amount of money to people who were not on their books, who were not registered with them, who were not in the system. So a system had to be put in place, and it had to be built from scratch. And they obviously had stop and starts, and they obviously had breakdowns and whatever. Now I'm assured that the system is now working, and they have already paid almost 120,000 people, and they are going to be processing almost 600,000 people in the next few days. And we will be getting up to what we believe will be about 3.5 million people. Now, that is a phenomenal process, because many of the people don't have bank accounts. And you then have to find a way of paying them, either through e-wallet or whatever other platform. Some of them have bank accounts. You've got to validate them. You've got to find those people. You've got to check with SARS, Home Affairs, and everyone else. So all that process is now being done. And they show me they've done already 3.5 million. We've been validated and checked rather, and thereafter payment is going to happen. So the capacity of the state has been a major issue. Will there be consequence management? Of course there will be consequence management, where my colleagues, ministers, or even officials do not act in accordance with what they are supposed to do. COVID-19 has given a further boost to the capacity of the state. And I want to capitalize on that so that our capability of delivering more and more water, of registering almost 3.5 new people on our system, is something that I want to capitalize on and demonstrate that the state can have capacity. The state-owned enterprises, looking into the future, COVID-19 is going to give us greater capacity and capability to reset and reposition and even repurpose our state-owned enterprises. And I'm glad that a number of initiatives are now underway to address precisely the issue of our state-owned enterprises. South African Airways is a case in point. Through trial and tribulation, through consultation and arguments and fights and everything else, the whole SAA process is now reaching a point where we can move forward, where we can look and countenance a new airline that can rise from, say, if you like, the ashes of SAA, and an airline that can also combine a number of other entities to build not only an airline, but to bolster the aviation industry in our country. Now, I am pretty gung-ho about the future of a new South African Airways. I'm also gung-ho about the future of our aviation industry. And SAA is highly respected on our continent. And it is for that reason that Johannesburg will be used as a hub to be able to distribute COVID-19 medical supplies. So I see a good future for SAA. And similarly, I see even a better future for Eskom, and there are quite a number of other interventions that we are making around Eskom. And all these are being done in the proper way with proper consultation. And we'll soon be announcing the names of the State-Owned Enterprise Council, which is SOE Council, which is going to help in advising us in government to move forward with our state-owned enterprises. So post-COVID-19, I think our state-owned enterprises will be better positioned.
Thank you. Thank you very much, Mr. President. Ladies and gentlemen, we are going to be running out of time because, as you know, at 4 o'clock, we need to make way for the National Day of Prayer broadcast. So I'm asking you to please keep your questions short, one question per person. Adrian Basson, you are next, followed by Valdemar. Then Willem, Jordan, Henrietta, and Patiswa. In that order, please. Adrian?
Thank you very much, Mr. President, and thank you for this briefing. My question is about the preparation of our health system and the time that has been used through the lockdown. Now, the numbers we hear are often about PPE and field hospitals. But Mr. President, if I listen to the models by governments, the scientists advising government on the projections and the models, the two numbers they are very worried about are the ICU beds and the ventilators. As we know, when you go to hospital and you're in a serious condition of COVID, you need a ventilator and an ICU bed. I looked at the presentation from the health minister on Friday evening, and it seems to me like our ICU beds number has not grown. The capacity has not grown over the past 2 months of lockdown. It seems to me that we are still hovering around the 3,000 number for ICU beds. Can you please give us an indication whether you have updated numbers on the amount of ICU beds that we have? We saw that the modelers and the projections said we may need up to 25,000 ICU beds at a time when our curve peaks. We also saw the Department of Health, even in early April already, telling us that we may need 14,000 ICU beds. If we are still on 3,000 ICU beds, Mr. President, isn't that indicative of a health department also failing us and not using the time board through the lockdown to the best of their ability? Thank you very much.
Thanks, Adrian. Valdemar? Don't follow Adrian's example.
Very brief. Mr. President, thank you very much for this opportunity. My question is about the special COVID distress grant, which you said 6.5 million people applied. You're aiming for about 3.5 million receiving that grant. Does government foresee that this grant will become permanent? And if not, when do you foresee it will be suspended? Thank you.
Thank you, Willem.
Thank you for the opportunity. Has government's priority with regard to the restructuring of the economy been changed by COVID-19 at all? And against that background, what are the top priorities with regard to the restructuring of the economy? Thank you very much.
Thank you, Willem. Henriette?
Thank you, Mr. President. Are you satisfied with the way the World Health Organization is handling the pandemic, as well as how our own advisory committee is handling its duties?
Can you please repeat your question, Henriette?
Yes, my question was whether the President is happy with the way the World Health Organization is handling the pandemic, and as well as the way that our own advisory committee is conducting its duties.
Thank you very much. Patiswa?
Thank you, Mr. President. I just want to refer to one thing. The social grant enhancements that have been done are for a limited period. What's going to happen after that? And I'm raising this because the impact of COVID-19 goes beyond what we see now. There is going to be a huge psycho-social economic displacement as people are starting to lose jobs now. So in terms of government thinking, what are the plans and what is being prepared to deal with the impact in the short, medium and long term?
Thank you very much, Patiswa. We'll give an opportunity to the President to respond. We'll look at time after the President's response, and if we still have time, we'll take one or two last questions. Your Excellency, Mr. President.
Whether our health system is really prepared, the state of preparedness of our health system. We've spoken about field hospitals, and Adrian wants to know whether we are going to have sufficient ICUs, because the professionals inform us that we are going to need up to 25,000 ICU beds. Now, clearly, Adrian, this is the challenge. This is the big challenge, and we've sought to utilize this period of the lockdown to prepare even more. And whenever I have gone around to the provinces, I have been commenting to my colleagues in government that what you have put in place is not sufficient. I'd like to see you add on. And that has been heeded. When I went to KZN, they had already put in place about 4,000. And I said that needs to be even 10,000. And quickly they were able to exceed even that 10,000. And I was very pleasantly pleased when I went to Charlotte Maxeke Hospital, when they had already started putting in their field hospitals. But when I went to the hospital itself, they informed me that before COVID, they only had 12 ICU beds, and they've now ramped them up to, I think, something like 112 ICU beds. Now, that for me was pleasing. And I've said to the other hospitals as well, we now need to ramp up the ICU, because this is now the greatest need. And I would like our minister to focus more on the establishment of those beds. And it is possible to do it. When I went to the new hospital that we are going to have in KZN, the Pixlikai Sakaseme Hospital, already they were putting in the ICU equipment. And it is possible to do it. And I would like to have this being increased exponentially. 25,000 is quite a lot, but we need to increase beyond the 3,500 that we have. And I will be focusing more attention on this, because clearly this will also stand us in good stead for NHI. And so I will be giving more and more of a focus. Now, I wouldn't say that this is the health department failing us. Remember, they've been at this for the last, if you like, 65 days or 3 months, and they have achieved a phenomenal feat in many, many ways, and we need to give them the time to be able to do so. And what we need to do is to prod them on, to encourage them that they need to do more. And that is why we allocated a budget of up to 20 billion to enable our health response to be up to the level of meeting the challenges of COVID-19. The COVID distress, do we see this? It was from Willem. Do we see this as being permanent? No, our current plans are that this is a COVID-19 time-limited or bound distress assistance. And given the resources that we have in government and the resources that we need to put in place to dig our way out of the hole that COVID-19 is depositing us into, because we're still going deeper into this hole, we will not immediately have these resources. What with our revenue source shrinking, we saw and we had the commissioner of SARS saying that we are going to be short 285 billion rand. Now, that is money that could have come in handy. We're going from a fiscal point of view, we are in serious situation. And what we have done was to craft a 500 billion assistance, both relief and social and economic relief package, to help to navigate vulnerable people in our country, as well as companies that are in distress. And this is clearly for a limited time. And some of the money we've had to loan, we've got to loan from a number of centers, like for instance, the New Development Bank the African Development Bank, the IMF, the World Bank, and so including internal sources that we have to rely on. And to raise almost 11% of your GDP is quite a bit of money, and we've decided that we must have this. But what that also raises, Willem, is that there is a need for us to start looking, as I think other organizations have said, we now need to start looking at how we give assistance to our people who are in distress for a longer period in their own lives, where there is poverty, where there's inequality. And let me immediately say that a number of countries in the world are already saying, even those countries that were vehemently opposed to even countenancing a universal social grant of some sort, are beginning to countenance that. Now, COVID-19 finds us in a very dire situation where our economy has been in serious trouble, and with the downgrading, we're in much bigger trouble. We now need to find a number of ways to address all these challenges. But for now, this assistance will last for 6 months. We announced that we are going to give this assistance both to do a top-up on the child grants, the old age pensioners, the disability grants, as well as the grants to the special grant for unemployed people. So this is going to be available for 6 months, and we've made that very clear right from the beginning. And obviously, we know we are going to face other challenges going forward, and it is for that reason that we say we now need to look at recovery, economic recovery that needs to address itself to precisely some of the problems that you are alluding to, Willem. How we address issues of unemployment and even issues of hunger. Now, another question was, I didn't get the name, has COVID-19 affected the restructuring of our economy? And are we going to be able to move on with the restructuring of our economy? The answer to both is, well, has it affected it negatively? No. If anything, COVID-19 now gives us even a much stronger platform. It gives us even a much stronger reason, if you like, if we ever needed a reason, but it gives us even a much stronger rationale to transform and restructure the economy. Our economy is crying out for restructuring. We've been operating under an economy that is both colonial and racist over the many years. And that economy now needs to be realigned to deal with the challenges that South Africa faces right now. And it is for this reason that we say, and I'm glad that many other people, including people in business, are saying we now need a reset of our economy. And a reset of our economy must mean that we've got to transform the economy. We've got to make our economy to be more aligned with inclusive growth. Those are the key priorities. Inclusive growth. It must be an economy that is going to respond to the poverty that prevails in our country. It must be an economy that is going to be, in a very direct way, be aimed at creating jobs. My strong view is that we shouldn't and cannot carry on as a country countenancing, living with 10 million people out of work. We've got to do as much as what it takes to make sure that we restructure our economy and to reposition it so that it is able to address all the challenges. And of course, the priorities are going to be that our fiscal position must be properly strengthened. We need a much stronger fiscal positioning. We must have a productive economy. So we must look at all our industries, our sectors of our economy rather, and make sure that they become productive. We industrialize, we localize, and we foster the empowerment of women in our economy, and we focus on youth empowerment and bring in young people into economic activity. Disabled people must also be well positioned in our country, and we must look at various sectors. The land question has to be addressed. Agriculture needs to be a key component of the growth trajectory that we need to have. We need to look at infrastructure to be the real flywheel that is going to drive economic growth in our country. And when we look at the infrastructure, there is a lot that can be done and that we will do to upgrade the economic growth in our country. Many countries that have come out of a post-war type of situation like we do now, I characterize post-COVID-19 as almost a post-war situation, have often relied on infrastructure to bolster economic growth. And that is precisely what I would like to see. So infrastructure is going to be one of the key backbones of economic growth going forward. And it will also lead to restructuring of our economy as well, as we have to do local manufacture of the materials that we use in infrastructure. Am I happy with the way the World Health Organization has been handling the pandemic? Yes, I am one of those leaders in the world who's been saying, yes, I'm happy with the way that the Director General, Dr. Tedros Ghebreyesus, has been handling the pandemic. And we say that the World Health Organization needs to be at the center of the global health response. They need to be strengthened. And it is for that reason that I also participated in a global fundraising effort to raise funds for WHO in the wake of the US also wanting to withdraw money from the WHO. We believe that more and more of us around the world need to be supporting the work of the WHO. And I'm also in full support of the medical advisory committee that Minister Zweli Mkhize has set up. It's been doing a fantastic job. And they have been guiding us. They've been guiding us in this whole process. And the little blip that we had a few days ago is to be expected in a group of people, almost 51 people, who work together, who are scientists, who are professionals, who are all the types of wonderful experts that you want, will often have different takes on what we are dealing with. And I welcome that. I welcome diverse views. And now they've been guiding this whole process. And what we are doing, I want to reiterate, is guided by science. None of us is flying by the seat of our political thoughts. It's guided by science. And that is what we've been following. Patiswa asks, the social health enhancement, I answered this, is it for a limited period? And what are our plans? And Patiswa, I answered this. It is, yes, crafted for this limited period. We don't want to deceive our people. We did say upfront when we announced it that it will be for 6 months. And there had been a proposal that it should be for 3 months. And I strongly felt that it should be crafted for 6 months to assist our people as much as possible. And the cabinet endorsed that. And that is now what is in place. And beyond that, we know the hardships that our people are going through, and those will also be addressed. What COVID-19 has done for us, for all of us, and indeed it has done the same all over the world, is to bring to the fore much more frontally the serious challenges that are faced by many people in not only South Africa, but all over the world. But in our case, our response has been a response that has been underpinned by solidarity, a response that has been underpinned by government's determination to support and assist our people to get on with their lives. And post-COVID-19, we will be embarking on an economic trajectory that will also be seeking to do precisely that. Thank you.
Thank you very much, Your Excellency, Mr. President. Ladies and gentlemen, we have unfortunately run out of time. Could I propose that if you still have questions that you would have wanted responded to, you send them through via Mahlatsi, and we'll do our best to get those responses back to you from the President. Thank you once again for having made the time to be part of this briefing. And please do join the National Prayer Day broadcast that is going to start in the next few minutes. Mr. President, thank you. All members of Sanef and Chairperson Mahlatsi, much appreciated for the support as always.
Thank you very much.
Intensive briefing there between President Cyril Ramaphosa, members of Sanef, and various journalists. Journalists, obviously, they're making full use of the opportunity to ask the President some direct questions.